Hello and welcome to Rose City Politics. It is April 21st. Our regular panel tonight includes myself, John Lidke, and we have Doug Sartori here as well. Doug, how are you doing?
I'm doing great tonight.
I'm coming from the Windsor skyline. Where are you coming from?
Well, because we have a guest here tonight to talk about maps, my background is the map room from the 1981 Steven Spielberg hit Raiders of the Lost Ark.
It's frustrating because I was trying to think of what to make my background and I settled on, the very milquetoast Windsor skyline. And I just knew I was like, Doug's going to have something applicable. I spent 15 minutes trying to think of something applicable. It's frustrating.
This is my best skill.
You should definitely turn it into a side hustle before this pandemic ends.
It's going in my LinkedIn headline tomorrow morning.
There you go. We have a guest tonight here on Rose City Politics, Carina Luo, a geospatial data analyst at the University of Windsor, and we're going to be speaking about COVID-19 vaccine, neighborhood access, and geospatial data mapping. Carina, how are you tonight?
I'm great. Thank you for having me.
Yeah, thank you so much for joining us. You're coming to us live from the middle of a galaxy, it looks like.
Yeah. I love this feature. I just downloaded from the Analyst website. It gives me a lot of energy and joy.
That's great. It looks really great. I'm digging it. Thank you for joining us. And if you're listening right now and you're not a Patreon subscriber, head to patreon.com/Rose City Politics. It makes this show possible. We appear monthly in BizX Magazine and online at bizxmagazine.com, as well as on Facebook, Twitter, YouTube, and all of your favorite podcasting apps. So please do like, share, and subscribe. We also want to give a thank you to Leuna 625, Building Better Communities. They help us broadcast live on tape. So as we said, we're going to be talking about neighborhood mapping and COVID-19 access. As I said, our guest tonight is Carina Luo, data analyst who provides geospatial services to the University of Windsor through the Academic Data Center. She's researched COVID-19 vaccine and neighborhood access and decided to create an online web application exploring connections between COVID-19 vaccines and neighborhood demographics requiring better vaccine access. Rose City Politics last spoke about Carina on our November 18th show of last year. We were talking about her Windsor neighborhood walkability map application that she made for GIS Day. Again, thank you so much, Carina, for joining us. So we're going to jump into the article right now and get a bit of a background. CBC Windsor put this one out. Thank you to Jennifer LaGrassa. A University of Windsor data analyst is exploring those connections between COVID-19 vaccines and neighborhood demographics. Carina Luo, the geospatial data analyst. I love saying that. It's such a better title than online shit disturber. It actually, it sounds really good. Her research has revealed 4 areas in Windsor, Essex that have a large percentage of the target vaccine population, that's people aged 40 and older, but also a significant percentage of low-income residents, a demographic that already faces significant barriers to accessing healthcare. These areas don't have a clinic offering COVID-19 vaccines within a 2-kilometer walking distance. And even though there are 57 pharmacies across Windsor, Essex, there isn't one that's within these neighborhoods. This research has highlighted barriers that some communities may face and the need for officials to consider targeted community interventions to overcome these gaps. So we had mentioned that this web application was created. We're going to go into that in a bit after we speak with Carina a little bit. But I want to bring you in right now, Carina. Just what was it that made you decide to start doing this research? And I can figure out why you would do the application. We've spoken about you before. That's something that you do. It's a great service for this community. Let's be honest. But what made you think of starting to do that research at the outset?
So as you said, I'm a geospatial person. That I always interested in the data to analyze the data who has locational information. So want to dig into something and turn into something variable can help us to make better decisions. So when I remember as early March, when I heard a radio program saying the Ontario government will start a highlight program to around the local pharmacies to offer AstraZeneca vaccine to eligible residents. And I heard they published the list of pharmacies on their website. So when I go home, I open their website and immediately I found that they have list the address information for all the pharmacies in this program. So because address information is location information, so I immediately find there's something geospatial can play a role here. So make such information more understandable and more accessible to the general public. And also I found out there is no visualization tool on the government website. You can visualize all the locations on a map. So around the residents to make a better decision. So that's why I first start, initially I only create an app for the Windsor Essex region. And then after the Ontario government expand the list to more locations across the province, I decide to send my app to the whole province.
You're on mute, Jon.
I try not to have that happen. Thanks for that answer there, Carina. You know, I find it interesting that, like, I'm going to be jumping into questions right now throughout the article, but I find it so interesting that, you know, it took you using the skills that you have from your workplace to be able to not only identify these gaps that exist for people trying to get COVID, but also the visualization gap. I mean, I understand that this is something that you do on a day-to-day, right? But what does that say that, you know, someone at the University of Windsor had to put this together that is so useful, especially during this type of a time? Like, why, like, what should this kind of a thing be provided at the outset by the government?
Yeah, exactly. I feel like it should be the responsibility for the Ontario government to provide a tool, like make this information more accessible and useful for the users. Because I think for other provinces like Manitoba government, they create similar tool as my application on their government website. Actually visualize all the pharmacy as pharmacy vaccine site as well as the mass vaccination site in their province. But probably because Manitoba is smaller, they have a smaller population and they have a small number of public health units. And maybe their vaccination policy is quite different from our province. But I still feel like this should be the government's job to do that, because there is a liability issue here. Even though I can provide such visualization tool to fill the gap, but I'm not the government. I'm not from the government side. So the government cannot promote my app to the public, say, okay, you can use Carina's tool here, because they cannot guarantee, although I try my best to use the data from all the government resources, but I cannot guarantee like 100% there's no human error in that. So I think probably that's the reason there's a limitation for my tool to be used for by the public, even though it can be filled a gap there.
Yeah, definitely understand that, you know, the liability aspect is there. You don't want to be held liable because you're trying to do something and step up that the government hasn't provided. And, you know, you're being really polite and saying maybe it's because Manitoba is smaller. I don't know. Maybe it's just because their government's functioning better. I don't think that it should be a matter of comparing size to size. Personally, they should have done it properly at the outset. They haven't. And, you know, it's a great learning opportunity for sure. But let's dive into the web app that you made. So you identified service gaps in vaccine availability across Ontario, as you said, by mapping where the shot's being offered and overlaying those vaccine locations with neighborhood demographics. You chose various data sets for the map to visually show where people who can't work from home live, where low-income communities are, and where the province targeted vaccine age groups are located, obviously among other key characteristics. And you pulled all this from Stats Canada's 2016 census. So you identified 4 regions here in Windsor, in Windsor Essex that have a service gap. They are Sandwich Town, a neighborhood north of the airport, a neighborhood in Tecumseh, and a neighborhood in Comber near Tilbury. Can you talk to us about these neighborhoods and, I guess specifically what's making them unique in this sense?
So if you're looking at this app right now, so it's showing you one is the location of the pharmacy site, vaccine pharmacy site. Another layer is showing you the relationship between the population. Oh, I think this one is the old version of my app. Actually, could you just maybe just refresh first and see you can show, because I updated the data yesterday, so it's showing different layers. Oh, sorry. I think this one is the Windsor Access Pharmacy locator. Actually, I have one for the whole Ontario.
Oh, okay.
The wrong, yes, this is the initial project I created for the Windsor Access. Can you open one for the Ontario province, please?
Absolutely.
Yeah. So let's talk, I guess, just a bit more, about just what these while we get Doug to pull this up here, the 4 neighborhoods, obviously, they're not located near it, but what are some of the barriers, that these people face? You list, obviously, it's access to it, but what does that look like?
So it's like all these neighborhoods, they have the same characteristics, is they have a higher concentration of the vaccine target age group, like people who are age 40 years old and over right now, and the low income population. So think about that. If you live in a neighborhood, you have a lower income. If you don't have a private vehicle, maybe it's difficult for you to get access to your immediate neighborhood to get vaccine, right? So it's very beneficial if you have a pharmacy vaccine site within a walking distance. So that's why I identify this. I think as 3 neighborhoods in city of Windsor, and another one is near Lakeshore. That one is you don't have maybe like you don't have anything within 5 kilometers.
It's so interesting to be able to see it here mapped out. Sorry to anyone who's following along, listening in, you were already at a loss for not being able to see what was on screen, so didn't affect you too much. But if we're looking here, at the neighborhood in Sandwich Town first, Carina, we're looking here, thanks to CBC, they broke this out into a chart form for us, right? So the percentage of the population 40 and older in Sandwich Town, 65.2%, right?
Yeah, sorry to interrupt you, but if you can click that particular neighborhood, it will show you the particular numbers for that neighborhood. That's another feature of my map. So just click on the brown neighborhood layer. No, one left down there. Yes, that's right. So you can see exactly how many people age 64 and over live in that neighborhood. So say like over half of the population is qualified for pharmacy vaccine, and they have a higher percentage of people who live in low income. So,
we can see there 15.2% in low income there.
So it would say this map is showing you which areas, if they are shaded in brown color, which means they have a highest percentage of people who age 40 years old and over, and also people who live in low income compared to other neighborhoods across the province. So it's like a high risk of neighborhood. However, they don't have any pharmacy within a walking distance. So they should consider as let's say pharmacy desert in this aspect.
Pharmacy desert, it's interesting because we've spoken obviously on this show before a lot about food deserts that exist in the city, and we haven't titled it amenity deserts before, but it's definitely been something that's come up before, and we're going to talk about that in a bit. And we're also going to talk about how there is transportation that's being offered. And I want to get your perspective on that, Carina, when we get there. But just still keeping it on the app here itself, you're going through all the research, you're mapping it all out. Did anything surprise you from what you came across here? Or did you expect to see what you came across? Like, what was the hypothesis going in?
My hypothesis is like for a big city, may have higher numbers of pharmacies available, like high density pharmacies. Actually, that's why I see from my app. So if you zoom into the map into a big city like Toronto, Mississauga area, you will see there's a high density of pharmacies. So for residents living in such a big city, they may just can reach a pharmacy within walking distance. However, if you look at some rural areas, some people live in the North Ontario, they probably don't have any pharmacy within 50 kilometers. So you can see a very obvious spatial disparity in the vaccine rollout across the province compared to the urban areas and the rural areas. But I probably understand because for urban areas, they have a higher population density, like higher disease transmission rate for COVID-19. But we still need to think about the people who live in the rural areas. They cannot be left out during this vaccine rollout process.
That's really interesting. I wasn't thinking about the rural distribution of it because we're focusing here on the lower income within the city itself. But I mean, there's obviously a lot here that our provincial government and the bureaucrats need to think about when it comes to creating this system and rolling it out. We had a general put a lot of time into it, and we can talk about the politics more about that later. This isn't the first time, Carina, that we've spoken about you on the show. Again, we said not the first time that you've made a community focused app. We talked about your neighborhood walkability map that you made news with. So is there a common thread line between your work that you seek to do? Like, how do you choose the projects that you do?
Usually my main job, daily job is I provide consulting services to the university faculty students about how to use and get access to geospatial data. But in my spare time, I will just, because I'm very interested in the open geospatial data. So any data may be open, accessible to the public. I want to take a look, and if I find it's interesting topic, no one has done it, I will just, try to do some research. I just do some data review, find out the research gap, and to see if I can use some methodology I know, and then use the data which is available to me, I can make something interesting. So but I particularly interested in the urban environment, health aspect of in social science. So usually my research is just naturally focused on that aspect. So for the walkability map, I created half a year ago because I just one day I read an article. I don't remember from where, but it's talking about the Toronto walkability index. So some researchers created a couple years ago, and I found out the article, and I very interested because walkability is, I think, is very important for any person who live in in a city, right? So I found there's a lot of reports for other Canadian cities like Vancouver, Manitoba province. There's Calgary, Toronto, but there's no one has done such research in Windsor. So because I live in Windsor, I love my city, so I try to do something can be beneficial to our community. Oh, wow. So yeah.
Aren't we so lucky to have you here? I know who I'm going to if we've got an idea on the show that we need something mapped or get some in-depth analysis on something. But it's so interesting just being able to visualize something. Obviously, the field of data visualization, and then stepping into where you're at with just with the mapping of it. I don't know the world of GIS that well, other than what Doug is willing to tell me in our side chats until he gets bored with me learning on the fly. But I guess, how would you like to see governments making this type of work for you easier? I mean, could they release data in ways that are more easily accessible? Could it be, you say you've seen reports in other cities, but you don't see them in Windsor? What are the things that would make your job easier? But really, what are the things that would make your job easier? So my job as someone who lives in the city, who wants to understand what my city is, what are the tools that the government can provide to you?
I think they will, if if with first of all, they need to provide more open accessible data to the public. So I know the city of Windsor and Essex County, they have an open data catalog, which has a lot of different kinds of data, including geospatial data, which the public can download and use for free. However, I still find some limitation there because sometimes they don't update the data so much, and some data which I'm quite interested in, but they are not available to the public due to some reason. So I found this very interesting because the trend right now is the data should be open accessible. So you can see from the Canada as a whole, the Canada federal government have an open data catalog, and for Ontario government they have Ontario data catalog, and different municipalities have an open data catalog. But the quality and accessibility of data across different cities and regions is quite different. So particularly for some big city, I think for the city of Toronto open data catalog, they have many more data sets which is accessible to the citizens there. I don't know because usually they have more funding to do that, or they think it's more important for the government to, to release that data. I don't know what the factors behind it, but I really hope our region they can just, make the data readable and accessible to the public and make us easier to, analyze the data. And for the COVID-19 per se, I would say, I contact government of Ontario a couple weeks ago. Because they just released a list of pharmacies on their website, but that data is not ready to use if I want to create an app. So I just press contact and say if I can get the data in a CSV file, which you can open in Excel spreadsheet, and it's easier for me to just develop an app. However, I didn't heard from them like after 10 days, because I know they said that processing time is 10 to 15 days. So I think I cannot wait that long. So I just self-taught myself the Python programming language, just do some web scraping to just automatically grab the data from the website. And it's very it's a painful process, but it's a good learning curve for me. And also I need to keep updating all the data all the time myself, because the government they keep updating their website. Another thing I want to mention is I heard a lot of stories, people telling me, right? They said your app is fantastic. However, when I contact an individual pharmacy, they told me we just ran out of doses. We don't know when the doses are available again. So I think it's very important. I don't know why the government cannot cooperate with individual pharmacies to make such information accessible to the public. They should have a special team to cooperate with the pharmacy and collect their vaccine administration data and keep it available to the public. Think about that. If I have my app and I can show people for each pharmacy what's the average waiting time, how many doses available there, whether it accept a new appointment or not. If I can show them such big information, that'll be very good. Very making people's life easier. However, unfortunately, right now, nowhere you can find such information. Even if you dig into such individual pharmacy website, like Costco pharmacy, like a Shoppers, Relax, they don't publish such information either. So I heard a lot of frustration among people about that. But for me, I don't know. I cannot fix this problem. Yeah, I don't know how to get that data actually.
If you're listening right now and you end up using Carina's app and you call a pharmacy and they don't have a vaccine for you, don't send her an email upset about it. It's not her fault. But so it sounds like, open data, very important. Standardization, if that could exist, I think that's a big ask. and then,
Yeah.
updating the numbers. Those, it seems like the three ways that would be easier for you. Doug, I want to bring your voice in. I know that you've got a comment on this.
Well, I just wanted to say it's great, Karina, that you're expanding your knowledge base and doing some screen scraping. That's terrific in terms of your learning. But in my opinion, when public data in 2021, when we as technologists have to use techniques like screen scraping to access data, that represents a failure of transparency and a failure to effectively communicate information. It's not enough to put information on a web page anymore. That was something that was appropriate 15, 20 years ago, but today governments need to be presenting data in a much more accessible way so that practitioners like Karina can do what they do best.
Yeah, I totally agree with you. Thank you.
Now, Karina, are there any other projects that you're working on currently that we should know about before we let you get back to your evening tonight?
Okay, sure. So actually, I want to compare. I know for another organization, they publish their number of COVID-19 cases around this vaccination rate by their FSA level. So FSA is the first 3-digit postal areas. So I want to compare the vaccination rate at that level with the demographic information which I can obtain from the census data, and maybe compare this with the spatial distribution of the vaccine pharmacy site. Because actually, if you go back to my app, I just upload a layer which is showing you the hotspot area which identified from the Ontario government in Windsor asset. So you can actually see which the neighborhood which has been mentioned in the CDC article, which says they are pharmacy that they don't have any pharmacy nearby. I think there are 2 neighborhoods actually inside the hotspot postal area. So the hotspot postal area is like they have a higher COVID-19 transmission rate and very low vaccination rate. So I think my next step will be very interesting to compare actually the vaccination rate with the spatial accessibility to vaccination sites.
Well, we will have to get you back on the show to talk about that once it's up, because we love to chat with people who are doing things that are useful in the community. And I, like Doug, I like to learn a lot more just about the tech side of things. But with data visualization, I find it to be it's so interesting because you're able to draw really useful policy outcomes or needs by looking at a map. And that's super useful. And it's something that, quite frankly, I mean, the city should be doing this, the province should be doing this, but really happy that you're doing this. So Karina, thank you so much for joining us this evening. It means the world to us.
It's my pleasure. Thank you so much again for having me.
Absolutely. Hey, you have yourself a great evening. We look forward to chatting with you again later.
Okay, you too, guys. Okay, bye, John. Bye. Bye, Doc. Bye.
Bye.